Good morning. This is Martin coming at you from Reform Body Clinic in the heart of the Byward Market in Ottawa. And I have a new video for you today, and it's all about back pain. And I wanted to share some really important things. I'm kind of going to get down into the real nitty-gritty of what causes back pain. And it spirals out of a conversation I had this morning where I have a patient here. He's been adjusted for, I don't know, probably almost 10 years. And he goes like, what do you tell people when they say I threw out my back, or they go and the family doctor says, oh, you just slipped a disc, and all this terminology. And I said, you know what, I'm going to shoot a video on this because it's going to be incredibly important to understand why that terminology is used, and it's not entirely accurate. But I hope this gathers you a little bit of understanding on why you can get sharp pain in your back. You can get, a pinching. You can get chronic tightness that happens that no matter what you do, you can't shake it loose. And for that, I'm going to use my model of the low back. And so, of course, if I'm sitting here, this is a model of my low back. Okay, so we're looking at it straight on. So now we're going to look at your low back from the side. And of course, you can see there's a little bit of a curve happening here. You have your bones, you have your discs, the cushions, and ultimately what I'm concerned about is you have these joints at the back, okay? Now, this is incredibly complex. I mean, if you just kind of look at this in a three-dimensional, there's a lot of stuff going on here, okay? And in order to live pain-free, you need this structure to move properly. And so I think when people say, hey, I threw my back out again, ultimately what I'm thinking is, well, you're in an injury cycle in your back because the root cause has never been addressed. So when you throw your back out or slip a disc and all of a sudden you are in some kind of back pain, sharp pain, stabbing pain, the pain that can, people drop to their knees with back pain. This I'll do very close for you guys, but you have these joints at the back. These are what are called your facet joints, and there's two for every vertebral subluxation, these two complex, these two bones that sit on top of each other. So you have a right and a left facet joint. Now, if you look at this, these facet joints move, okay? And this is where the terminology comes from, because when someone says you slip a disc, it literally means or feels like you've slipped and jammed your back. And ultimately, that jamming is what happens. You have lots of nerves, you have lots of sensitive tissue in here, and you can pinch and put pressure on these sensitive tissues, and it can literally send you to your knees in back pain, right? So that's the facet joint. And that is that pinching or that sharp, that pressure that you get right in these joints right here. So why do we use that terminology when it comes to your spine? I do think that people like kind of a catch-all phrase because you do see back pain happening very often, but ultimately it's always a culmination of factors before you actually have that acute injury. So when we've talked last couple weeks about core strength, your muscles are important in controlling your back. We talk in chiropractic about subluxation. So when you talk about spinal stress and you talk about the spine not moving properly, this has been called restrictions, fixation. Different chiropractors or professionals may call it different names, but ultimately subluxation is these two bones not moving properly. And ultimately when things don't move properly, then you start putting them under load. You lift your kid out of the crib, you're in the gym and you do a weird deadlift and you slip and jam your back, you throw out your back. Ultimately, the root cause is that spinal structure and spinal function don't work properly, okay? So I hope that makes sense to you guys so far. So really getting into the technical side of back pain. Now, how do you correct pain in your spine? Well, the assessment is incredibly important. The hands-on exam is incredibly important. And ultimately, if you own a spine, it does have to get adjusted on a regular basis, just like all the other healthy things you would do, like yoga, massage, brushing your teeth to keep them clean. It's exactly the same thing. Everyone develops spinal stress, and it's an adjustment that is the cure for spinal stress. Okay, so just before we finish up for today, I do know I showed you the low back because statistically we do know that that low back, 80% of people have low back pain, but it's the exact same thing in the middle back, and it's the exact same thing in the neck. And what symptoms somebody experiences or where the pain comes from really depends on where that person keeps the majority of their stress, because you do find someone with chronic upper neck problems, that tends to be headaches, migraines, stiffness, they throw or crick in your neck, if you've heard that one before. These are common things that you're going to find that come out of your upper neck. And of course, with the low back, it tends to be that debilitating pain, sharp, stabbing, chronic stiffness is another big one. And over time, it can get really bad into that sciatic nerve, so sciatica, which is obviously pain down the leg. So I hope that helps you a little bit. These little facet joints run right from the top, right from the bottom of your spine. So literally anywhere along those 24 bones and those 2 facet joints, you can get pain from the spine itself. And that's why I wanted to shoot this video for you today, because the terminology like, oh, you threw your back out again, oh, you slipped a disc, take it easy. Well, the research doesn't really support language like that. We want to figure out exactly what's going on in your spine in terms of your structure, your function, and ultimately that's the only way you're going to live with no back pain, the strong and healthy back to carry you through all your day-to-day activities. All right, signing off. If you know anybody who needs to know this information, share with them. Tag someone who should watch this, whether you're on Facebook or on our YouTube. But this is Martin signing off from the heart of Ottawa in the Byward Market. Take care.